Numerous studies have reported on the inability for conventional therapies such as cognitive behavioral therapy and eye movement desensitization and reprocessing to sufficiently treat PTSD symptoms due to their reliance on verbal expression. This is a problem because depending on the individual, verbal expression may not be viable. Scholars have found that those with prolonged traumatization and inefficient verbal memory often fail to benefit from conventional therapies for this reason, and so propose that due to its non-verbal potential, art could be a more beneficial and accessible PTSD treatment. I set out to prove that the creative arts not only have the therapeutic ability to reduce adverse mental health issues associated with PTSD, but are essential factors in mental health improvement. The way I went about proving this claim was by collecting sources using the Purchase Library databases. I paired the terms the creative arts, creative expression, and art therapy with PTSD, stress, and depression, occasionally including terms such as treatment and healing. Since this topic is young in comparison to other mental health research, literature published between 2006 and 2018 was included as it appeared to be the most relevant and comprehensive. While my findings highlighted the creative arts' therapeutic ability to reduce PTSD symptoms, my analysis focused on addressing their therapeutic benefits, how they facilitated healing, and which creative modalities were most effective in reducing PTSD symptoms. I structured my findings according to creative arts modality. First examined were the effects of general creative interventions like art, dance, and music, and the effects of specific creative modalities, music and visual art therapy, and lastly the effects of single art therapy methods, mask making, and mandala drawing. In reviewing 37 studies from 1980 to 2016 concerning drawing, music, and dance, Martin and others provided an overview of the creative arts' efficacy in reducing stress. Their findings indicated that the nonverbal characteristics of these interventions not only reduced stress, but facilitated cognitive ways of coping and increased emotion regulation. In 2016, Blumdahl and others highlighted the creative arts' efficacy regarding depression, which is another common PTSD symptom. They provided 18 occupational therapists with 5 to 35 years of work experience a questionnaire and identified 2 of the assertions most agreed upon: that art was a catalyst for the expression of depressive thoughts and, due to its ability to withdraw dialogue, was a beneficial way to integrate trauma. According to Lyshak-Stelzer, the use of the UCLA PTSD Reaction Index also showed art to encourage the verbalization of trauma. After art therapy treatment, PTSD symptom severity was shown to decrease 20.8 points in the experimental group and only 2.5 points in the control group. This evidence emphasized the creative arts' ability to reduce common PTSD symptoms and facilitate dialogue. Concerning visual art therapy, in 2006, Spiegel and others demonstrated how the use of pencils and watercolor paints facilitated relaxation, which reduced hyperarousal, symbolic expression, which reduced avoidance, and creation, which reestablished self-esteem and reduced emotional numbing. Within this study, a 2006 study by Avrahami, a 2016 study by Smith, and a 2018 study by Schouten also demonstrated was the visual arts' ability to contain and displace trauma through symbolic expression. This concept, known as containment, enabled a sense of control and one to perceive their trauma from a new perspective. Concerning music therapy, in 2010, Stuckey and Nobel investigated the theory that music reduced physiological PTSD symptoms. Since symptoms could have negative cardiovascular effects, music therapy could reduce physiological symptoms since it could reduce the psychological symptoms which cause them. In support of this, Landis, Shack, and others examined the neurobiological ways music reduced PTSD symptoms and found that it also increased the release of endorphins and reduced cortisol. These findings prove that specific creative modalities heal symptoms left untreated by conventional therapies like emotional numbing, contain trauma, and reduce both psychological and physiological PTSD symptoms. In 2018, Kaimal and others argued that mask making was beneficial in treating PTSD after discovering that the themes expressed in the art of 370 veterans represented their internal trauma. The color blue represented internal depression and military symbols represented internal anxiety. This external depiction of trauma sufficiently indicated specific PTSD symptoms. Henderson examined the effects of mandala drawing on 36 undergraduate students who experienced trauma. Findings indicated that, compared to a control group, those who drew mandalas had greater PTSD symptom reduction. Since such results were exhibited long-term, the authors declared that mandala drawing induced changes deep within cognition, proving its worth as a viable PTSD treatment. While Kaimal was concerned with marginal data acquired from the clinical setting, Henderson lacked variety regarding groups of comparison. The inclusion of primary data, as well as control groups with varying factors, would have allowed for more definitive data. The creative arts' primary therapeutic ability is its ability to reduce adverse mental health issues associated with PTSD. Specifically, general creative interventions heal stress and depression by enhancing coping strategies and control. By utilizing multiple measurement tools which revealed consistent results, Martin and others informed audiences that the nonverbal aspects of art, music, and dance facilitated cognitive ways of coping, increased sense of control, and reduced stress. Blumdahl and others also effectively informed audiences of these therapeutic abilities by citing therapists who had an average of 27 years and 19 years of work in art therapy experience, thus proving the reliability of their findings. Specific creative modalities facilitate resilience towards PTSD symptoms through relaxation and pleasure. In examining fMRI neuroimaging studies, Landis-Shack demonstrated how music therapy increased blood flow to the areas of the brain associated with pleasure, and so exemplified its ability to neutralize negative emotion. By relaying patient reports, such as that of a veteran who witnessed a child's death, and including how, after creating a clay statue of this memory, the trauma became less burdensome, Schouten and others highlighted the visual art's ability to improve intrusive thoughts, relaxation, and resilience. Single art therapy methods facilitate healing by presenting nonverbal internal trauma externally, indicating specific symptoms to be targeted during treatment. Keimel and others enlightened audiences of mask-making's ability to symbolically depict psychological injury. They revealed that the participants whose masks depicted this theme reported the most severe symptoms, and concluded that this external depiction of trauma was clinically significant as it directed focus towards specific PTSD symptoms. Henderson and others disclosed the personal accounts of participants who experienced repeated exposure to adverse stimuli through mandala drawing. These mandalas depicted the symptom of anxiety, and so that specific symptom became a focus during treatment. According to Landis-Shack and others, group music therapy is most effective as it reduces stress, avoidance, and arousal, and improves socialization. Authors investigated the effects of group drumming therapy on adults with PTSD and presented the treatment as a stand-in social process, which encouraged collaboration and diminished anger, avoidance, and arousal through cathartic release. By utilizing such convincing evidence, the authors revealed group music therapy's efficacy in improving mood disturbances and social connectedness. Group visual art therapy diminishes emotional numbing, encourages social bonding, but most importantly, facilitates trauma processing. In vetting research on brain imaging, Spiegel and others illustrated how trauma processing was inhibited by hypoactivity and hyperactivity in the areas of the brain responsible for speech production, fear perception, and visual processing. By including evidence of these neural hindrances, the authors accentuated group visual art therapy's efficacy as a treatment capable of facilitating trauma processing, effectively asserting its efficacy as a PTSD treatment. Although different approaches were taken regarding the inadequacy of conventional therapies, studies have effectively championed the creative arts as an accessible and beneficial alternative to PTSD treatment. Most notably, general creative interventions, specific creative modalities, and single art therapy methods have been found to reduce depression and stress, enhance resilience towards PTSD symptoms, and present nonverbal internal trauma externally. Amongst these modalities, group music and group visual art therapy were identified as the most effective means of PTSD treatment due to their ability to reduce mood disturbances, encourage social connectedness, and facilitate trauma processing. Further research on the duration and structure of treatment would be beneficial as opposing views and findings do exist. Considering their facilitation of healing and overall effectiveness, and due in part to their nonverbal potential, the creative arts possess the therapeutic ability to reduce adverse PTSD symptoms, and so not only serve as a beneficial and accessible alternative to CBT and EMDR, but are essential in improving mental health. Thank you.